Hi, I'm Daniel Weber. This is called Words in Progress. It's sort of my rambling about things that I'm interested in, what I'm studying, and what has come into my mind at the moment. And I thought I would do one of these every month, send them out to you, and perhaps you find it interesting. At the moment, one of the things that, of course, is not only fascinating to me, but to everybody else in the field of oncology is the issue of cancer metabolism. Cancer is a metabolic disease. Cancer is not like a normal disease, which is associated with various systems. It's a disease that may take 20 years to develop. It has dozens of causes, dozens or more treatments of that. In medical oncology, there are pretty straightforward ways of working with it. Surgery, chemotherapy, radiotherapy, and they're big, bludgeoning tools. And I'm not here to talk about them. They are just what they are, and this is what most people go through. But what I want to talk about is it's a much more subtle way of working with it. How do we alter the metabolism of a tumor? Now, tumors are different than normal tissues. Tumors operate on aerobic glycolysis, but it produces lactic acid, which is very different than what normal healthy cells do. Cancer cells are very, very poor metabolizers of energy. They actually produce 1/6 of the energy of a healthy cell, which operates on a different metabolic pathway involving the mitochondria. But what they do in this kind of environment, they operate in a low oxygen environment, even though there is plenty of oxygen available. And this hypoxia, low oxygen level, is often accompanied by concurrent inflammatory issues, elevations of inflammatory cytokines. It's associated with things like blood stasis, blood stagnation factors, adhesion factors. There's an enormous amount of things. And these tumors create an environment which is distinctly different than healthy cells. And this is what promotes their growth. The theory is that if we can alter the metabolic pathway of a cancer cell, of a tumor, you can change its outcome. It's not like trying to kill the cancer. It's not like trying to overcome the cancer. It's just like changing the cancer back to a function of a healthy cell. Now, there's an interesting thing in my studies recently has been something called AMP protein kinases, AMPK. And this is a kind of a metabolic factor that arises in low oxygen or low metabolic function. And it's often associated with cancer growth and metastases. Studies show that we can actually alter AMPK function, and simple compounds like berberine, like purarin, a number of Chinese herbs are associated with altering this. And they are actually the same herbs that alter metabolic syndrome. And the theory is that actually cancer and metabolic syndrome, pre-type 2 diabetes, are actually the same disease. Now, how it happens that some people get cancer and some people get type 2 diabetes is another seminar. But interestingly enough, if we can alter the metabolic pathways, these issues of how cells use sugar, if we can alter these metabolic pathways, we can actually retard cancer growth and perhaps, ideally, even stop a tumor from growing. Anyway, these are my thoughts at the moment. I'll see you next month.